I'll be presenting on behalf of the study chairs from Australia and Taiwan who are not able to be here today. So Professor Chi Li, Associate Professor Samantha Bauer, Dr. Bin-Chi Liao, and Professor James Yang. So DEFIANT is a phase 2 trial of datopotamab deruxtecan or Dato-DXd in metastatic non-squamous non-small cell lung cancer with EGFR exon 20 insertion mutations following progression on targeted therapy. Just by way of background, in the aspiration program, we saw that EGFR exon 20 insertions occurred in approximately 8% of all EGFR mutations and about 25% of uncommon mutations. Unfortunately, patients with EGFR exon 20 insertion mutations do not respond to osimertinib or earlier EGFR TKIs as well. So, there are newer first-line treatments available for patients with EGFR exon 20 insertion mutations. On the left, this is amivantamab and chemotherapy in the PAPILLON trial, and on the right, somvosertinib in the Wukong 28 trial. Whilst both of them showed improved outcomes compared to chemotherapy, the median progression-free survival is still only about 10 to 11 months. In addition, treatment options are generally limited to chemotherapy once patients progress on targeted therapy, and therefore EGFR exon 20 insertion mutations represent an area of unmet need. Dato-DXd is an antibody-drug conjugate consisting of humanized monoclonal antibody to TROP2 attached to a topoisomerase I inhibitor payload. The activity of Dato-DXd in patients with pre-treated metastatic non-small cell lung cancer with EGFR mutations have been demonstrated in the phase 2 TROPION-Lung05 and the phase 3 TROPION-Lung01 trial. I guess just drilling down to the EGFR subgroup in TROPION-Lung05, the objective response rates were about 44%. Now, most of them were common EGFR mutations. However, in the red box, there were a few patients who had exon 20 insertion mutations and uncommon mutations and showing some preliminary activity. So therefore, the aim of DEFIANT is to determine the efficacy and the tolerability of Dato-DXd monotherapy in these patients with EGFR exon 20 insertion mutations who progress on targeted therapy and chemotherapy. This is a study schema, so it is a single-arm phase 2 parallel study conducted in Australia and Taiwan. We hope to recruit 50 patients, 25 from each country. Key eligibility is on the left-hand side, so patients with metastatic non-small cell lung cancer, EGFR exon 20 insertion mutations, prior TKI and amivantamab is allowed, measurable disease via RECIST 1.1, performance status of 0 to 1, and untreated and asymptomatic brain metastases are allowed. At the bottom, we have the exclusion criteria, so the concurrent common EGFR mutation, a concurrent driver mutation, for example, KRAS or BRAF, more than 3 lines of prior systemic therapy, and previous TROP2-directed therapy. Dato-DXd is prescribed at 6 milligrams per kilogram every 21 days until disease progression or intolerance. On the right, we have the endpoint. So the primary endpoint is objective response rate according to RECIST 1.1. Secondary endpoints include duration of response, progression-free survival, safety, including CTCAE, as well as patient-reported outcomes, and overall survival. Tertiary endpoints include looking at baseline TROP2 QCS, clearance and ctDNA dynamics, as well as genomics. So currently we're at protocol development, and today we hope to generate some interest and enthusiasm for recruitment. We will be sending out feasibility studies soon, so after this ASM. If all goes well, we would aim to have the first patient in Q1 next year and trial activated in 15 Australian sites. So we can also look for patients through the Aspiration 2L. So thank you very much for your attention, and I'm happy to take any questions.
Great. Thanks, Deb. We've got a question. Okay, Mel is going to ask a question.
So we heard from Sanjay that increasingly, we need to collaborate cross-country to do these IITs. I've dipped a toe but not had a lot of success in the realm. Obviously, yourself and she have worked with James Yang before. In brief, opening this type of study across countries, does it effectively, the governance, like two separate countries sponsoring in there, any sort of pearls of how we can do this more in an efficient and timely manner?
Yeah, so I think this trial is really built on the success of the Illuminate study, so done previously between Chi and also James Yang. So in terms of coordinating, we have two different coordinating centres, one NHMRC CTC in Australia, and in Taiwan there's a cooperative oncology group. And in terms of, I guess, there will be both kind of local steering committees, but also an international steering committee in terms of governance, and the database and the statistics will be covered by or kind of led by the CTC here.
Yeah, thank you.
I just wanted to ask, in terms of eligibility, do you need a fresh biopsy, or are you happy to use the initial tissue?
That is currently in discussion. So we will get back to you on that. So in discussion with AstraZeneca and yeah.
So this is very welcomed because we're going through the molecular tumour boards each week, which have been EGFR heavy as we expected. And Dato-DXd is an FDA-approved, drug in this circumstance, and our access in Australia is at the moment not an option. So I think this will be really successful, bringing it in under aspiration too.
I also think it's pragmatic. It's good to have been able to use TKI and AMI, very pragmatic design. So
yes.
It's right where we need something.
Yes.
Yes, Michelle.
I don't know if this is on. I can just comment about whether or not we need a biopsy for this one. So this one we don't actually. This one we can just get in on ctDNA. Assuming now this is going to be second line, that patients will have had an initial EGFR exon 20 insertion mutation at some previous archival time point. It's the next one that's going to be.
Oh yes, thanks, Michelle. I was getting confused.
So sorry, Michelle. If the ctDNA is negative, it's still okay, right?
That's my understanding.
Yep.
Yeah.
Apologies about that.